We all know that one of the cornerstones in treating hair loss is minoxidil. In the market, this can be in the form of an oral capsule, a foam, or in a solution.
Which one then is most suitable for us to use? Let's find out in episode 12 called Minoxidil Match which one is right for you.
Hello and welcome to another episode of Hair Transplant PH. I am Dr. Jean Marie Marquez, a board-certified dermatologist.
And I am Dr. Teresa Marie Cacas, a board-certified dermatologist and a hair transplant specialist. For this channel, we'll share with you facts on hair loss and its medical and surgical management. So if you, a family member, or a friend is suffering from hair loss, or if you just have great interest in this topic, just click and like the subscribe button below.
One of the oldest approved treatments for male and female pattern hair loss is minoxidil. It is a blood vessel dilator which was initially used to control resistant hypertension. It is believed to promote hair growth by improvement of the microcirculation around the hair follicles and by induction of some growth factors.
It also works by shortening the resting stage and lengthening the growing stage of the hair cycle. Minoxidil is manufactured in topical and oral forms. For the topical form, you have your solution and foam. The question now is, which one is best for us to use? Of course, the choice will be dictated by a number of factors.
So what are these factors? So our first consideration is the degree of hair loss. So both the topical and oral forms of minoxidil are found to be equally effective in studies for the management of male and female pattern hair loss. So in the clinics, after further evaluation, your physician may prescribe to you one or the other. Remember that for both, it will only work if you still have hair. So a patient coming to us with Norwood grade 2 or 3 for males or Ludwig stage 1 for females will have a better chance of response as compared to the latter stages of hair loss.
Second consideration is level of compliance. Both topical and oral forms of minoxidil should be used daily and for life to sustain its effects. If you feel that you can apply the solution or foam daily or on your scalp once or twice a day, then by all means use the topical form of minoxidil. But if there is some doubt that you'll not be able to sustain this daily practice, then the oral form might be easier for you.
So the third consideration is accompanying medical conditions. The topical form of minoxidil, specifically the solution, may be associated with side effects such as skin irritation. Therefore, if you have like skin atopy, seborrheic dermatitis, and other scalp issues, you might be prescribed with the topical foam or oral form of minoxidil instead. Also, a small population of our patients may experience headache, lightheadedness with topical minoxidil. So if this happens to you, then the oral form might be a suitable alternative.
If you have cardiac issues, liver problems, kidney disorders, if you are pregnant or breastfeeding, if you are very young or very old, or if you are maintained on a list of maintenance medications, then your doctor might prescribe the topical form instead of oral minoxidil.
So the fourth consideration is availability of medication. So locally, we have topical minoxidil solutions available in the market. It can be bought over the counter, so access to this form is easier. The oral form, however, cannot be bought in our local pharmacy yet. So your physician might be able to prescribe this medication to you through a compounding pharmacy if you are a candidate for oral therapy. So currently, the use of oral minoxidil for hair growth is still an off-label use. So you might want to speak with your dermatologist if this is the right medication for you.
Lastly, always remember that the use of minoxidil is highly recommended and encouraged at the first sign of hair thinning and hair loss. That for hair, much like skin, daily and combination therapy will always be best. Majority of our patients do respond to minoxidil, but there will still be a few who will be non-responders. This medication will definitely improve your hair and slow down the thinning process. However, in time, some patients may still require hair transplantation for best results.
So we do hope that this short session gave you some insights on which minoxidil is right for you.
Remember, always be guided by your dermatologist or hair specialist so that you can use these products effectively and safely. Looking forward to our next episode as we walk you through your hair journey. Bye!